introduction.
Hi, so we're IPTS group 9b from section C. Our proposal is called Greening the Grass. And our team definition of radical belongingness is radical belongingness in the healthcare field describes an active approach to accepting and validating patients, families, and healthcare workers by recognizing and embracing every aspect of their lives. Differences that have caused division and a sense of otherness in society is not one's identity when someone looks through the lens of radical belonging. No one has to reach a certain standard. They can be themselves without fear of repercussions. Through this lens, our healthcare field yields better outcomes and experiences for patients and workers alike.
So by having this good sense of belonging allows for each field of healthcare to express their expertise and findings without a fear of being left out or the feeling that their input is unwanted. Belongingness in healthcare should manifest itself as an atmosphere of fluid communication between each facet of the profession. By allowing and encouraging the team to be on the same page, the frustration of misinforming the patient is reduced significantly. Also, working in healthcare is not always the easiest job, and having a sense of trust and camaraderie among your team can relieve many of the stressors we are exposed to. So with all that being said, our proposal is called Greening the Grass, and many of the anecdotes from M Health Fairfield, the staff is finding itself wondering if the grass is greener on the other side of the fence, whether it was with regards to better compensation, better work-life balance, or the absence of emotional strain that occurs in being a healthcare worker. There are several reasons why those in healthcare are contemplating changing the medical organization for which they work or changing their entire field. There is a suggestion that they may in fact be correct for what it's worth, at least with regards to compensation. Greening the Grass seeks to focus on addressing the discrepancy between what healthcare providers experience in their current employment and what they could have elsewhere to improve worker satisfaction and retention.
So we have put in place different recommendations on each level, the organization, team, and individual level, to try and promote a better healthcare setting for all employees to work in. So at the organizational level, some of the things are listed on the slide, and I'll be talking about each one of them in more detail. So the first one is promoting work-life balance. We want to make sure that employees get a sufficient amount of PTO time, and there's clear rules on taking time off, and that workers actually have their opinions put into the policies, and their opinion gets taken in and validated. For example, something that recently happened with a clinical instructor of one of our group members is that he had to take PTO for COVID illness. And due to this, he was unable to take time off, paid or unpaid, for his wedding ceremony and all the events surrounding his wedding. And for this reason, the company ended up losing a good worker just because they weren't willing to work with him under these circumstances. And there was not clear guidelines on how to go about taking off with a situation like COVID being ever changing. Another thing is encouraging workers to use their PTO. So there are some companies that work like consulting in business, they work commission based. So when they do have PTO that they can take off, however, it negatively affects their productivity percentages. So it's sort of a type of thing where it's like you can take off, but it's going to negatively impact you in the future and your ability to get on more desired projects, and it'll impact your bonuses negatively at the end of the year. So we really want to make sure that employees have the opportunity to take the time off that they need without being penalized. Another thing we talked about is increasing wages for workers and providing compensation for overtime or being on call. In a hospital system that one of our team members worked at, there was a previous system where on weekends there would be workers on call, and if someone no-showed or they had to call off, that on-call worker was already getting compensated for being on call, and then they would get compensated higher than a typical day for coming in to work on that weekend day. This system is now no longer in place, and seeing how it negatively affects the day-to-day does make a difference, as now the workload gets taken on by all the other workers, and now they have to stay longer. And since they are salary based, they're not going to be compensated more for doing this. Another guideline to put into place is more clearly defining what salary workers' hours are. Salary workers will work beyond their typical 9 to 5 or whatever their scheduled hours are, and that's expected. But this should not mean that they are working around the clock just because they are salary. Another thing at the organizational level we talked about is focusing on internal promotion to workers that are already in the organization. So we want to pass on positions to people who are already in the organizations and show that they are valued workers and give them opportunities to advance in their field, rather than posting applications to completely new applicants first. So an option of how we could do this is post job openings in settings that are public and seen by all coworkers, including email and bulletin boards. And then also providing opportunities for additional trainings or certifications to workers so that they can be compensated for this as they're trying to advance their knowledge and provide adequate care in the organization. Another thing we talked about is promoting overall wellness in the workplace. So there are different programs that have been put into place in the past that promote healthcare wellness overall, which include giving compensation to workers for participating in different wellness programs, like counting steps and getting their annual doctor's visits done and dentist visits, and then also doing modules on different well-being components. And then there's different ways to make this into a competition with coworkers and get compensated for this positive part. Okay, so then the next thing we talked about is promoting workplace productivity. We would do this by providing incentive to workers that go above and beyond. And so this is important because at this time, there's a lot of workers that are saying, why should I go above and beyond if I don't get paid enough for this? So this would target the current issue I'm speaking about. And lastly, we thought that giving workers an opportunity to get childcare services and other additional services would be a good option so that workers can focus on their jobs and not worry about having to run home, get everything done fast so that they can pick up their children from school or, take over for the caregiver. So we thought that this would also be providing more jobs and more opportunities for parents who are of the working class.
So some recommendations that we have for the team level are holding more team meetings when necessary. They're not always needed, but sometimes we do have certain cases that are a bit more complicated. And so for those, we'd want to debrief. We also want to make sure that we're not holding meetings that can be where the information can be given in an email. That just is a lot easier for workers, and they don't have to take time out of their day just to go to these meetings if it can simply be written in an email. We also want to make sure that when meetings are held, that they're being held at a time where most people are able to attend or not taking time out of their lunch. Making meetings an opportunity for team bonding. So this just helps the employees get to know each other a little bit more, and things like walking outside or anything like that would be a lot more beneficial than just doing icebreakers indoors. And then also, when applicable, we want to have interprofessional meetings where members of each profession can be present to talk about pertinent information. This just helps us get information from different interprofessional members. And then we also want to encourage employees to use their vacation time. So according to U.S. travel associations, in 2017, only 52% of workers used their PTO. And this was because a lot of them just felt like it would be overwhelming for them if they had used their PTO. And then once they came back, they just felt like they would have a lot more to do.
So we just want to encourage team members to do that and make sure they're valued, rather than having a workplace that is super unbalanced.
At the individual level, some of our recommendations for improving the healthcare environment and preventing burnout. So to some extent, just the extensions of these organizational approach we mentioned above, better compensation with potential to match offers to similar roles in the areas that they're working in, as well as internal promotion, are going to promote a sense of value for the individual, which is going to help with burnout in that sense. Also, putting in place processes that recognize non-position members of the organization for weekly or monthly awards based off of measures such as patient compliments or standard of care goals. And the module members of the M. Fairfield Clinic expressed concern that while they were bonding with patients if they served, they felt that these efforts for patient care were being unrecognized. And so going through efforts to make sure that these are recognized, perhaps with like weekly awards and benefits that are associated with those. Additionally, having clear professionals and policies for worker protection. So having a clearly designated member of the division or the organization who is tasked with managing professionals' complaints that emerge. So like if a workplace has workers who are either unaware or concerned about maybe their actions or their words and how they can cause harm, that's not something that's making a bad statement about both that individual and the organization. So we think it'd be important to make sure that there are clear guidelines and policies for what sort of behavior is acceptable in the workplace, how to report and manage complaints, and how to protect those who come forward with complaints. Additionally, making sure that we protect people in the workforce from patients. And unfortunately, sometimes there's patients who bring stress into the workplace. They may take issues with the role in the organization, such as, maybe being upset with masking policies or other policies at the clinic. And so making sure that we adopt and implement policies and mechanisms to prevent, violence or verbal abuse of workers by patients, and promoting like a culture of zero tolerance with regards to this sort of behavior. That's something that's going to promote a better sense of value, protection, and safety for workers. Additionally, expanding existing health coverage plans to have some coverage for therapy or cognitive behavioral therapy and counseling. So those who are experiencing issues with their mental health have the means to address their stressors, especially for those who are working in high-risk areas. And in general, working in the healthcare field is stressful for everyone. Additionally, having some sort of modules for education on bias and professionals, and sort of going into the above points, and encouraging participation in team meetings by fostering non-judgmental environments. In terms of addressing the inequity of the pandemic on workers with regards to those with marginalized identities. So there's many factors such as exposure to transmission risks of COVID-19, anxiety and depression, and excessive workload, which leads to significant stress scores for those filling vital roles in the healthcare field. These stress scores have tended to disproportionately be distributed towards Black and Latinx workers, with them having the worst results on such measures as burnout, and those in professions involving intense physical activities, such as being a nursing assistant or medical assistant, also having poor stress scores. And these similar studies have also shown that if you have a higher subjective feeling of value, the work score goes higher. So a lot of our measures that we've addressed in our presentation above are targeted towards increasing that sense of value and institutionally recognizing it. One thing that we were talking about doing is having better interpersonal relationships between different people in the clinic. For instance, having shared work areas and lunch areas for members of the clinic would be a way to foster better communication while not impinging on time with excess requirements. In that sense, there would be less isolation of members of marginalized groups from other members of the team. Better familiarity would also promote more acceptance and a more resilient workplace. Additionally, it's also probably true that marginalized groups may tend to be those who serve in more patient-facing roles, and because of this, bear a larger part of the burden shouldered by patient-facing positions such as nurses and NAs, rather than physicians or administrators. This means that they are at higher risk for emotional labor from patient outcomes, as well as from patients acting out from such things as anger with masking protocols or exposure to viral infection. This is why taking care of patient-facing workers with these mental health resources and clear policies for escalation for abusive patients is important in reducing this disproportionate burden on workers from marginalized groups.
So now we'll talk about the implementation steps. We've talked about many ideas that for improving the outcomes, but now we need to talk about how we will actually improve. And first and foremost, I think where we talked about having a town hall meeting, and that will include workers from all different levels to come and kind of talk about what their grievances are and hopefully create a space where their worries are validated and create that space of radical belonging and bring the changes that they want to see that will help improve their experience of work. And then also it will get their opinions about the policy changes and kind of talk about rules that will hopefully continue to improve their experience and make them want to stay and create the best healthcare outcomes. We want to create clear rules for PTO and sick days, which we talked about before. We don't want to punish people for getting sick or make them feel like they need to be dishonest about being unwell. So we would like to set a number of PTO days that are protected and separate from the sick days. And then make sure that taking time off doesn't affect their productivity scores. But we would need to discuss what exactly the amount of PTO days are appropriate for each field. And then there would need to be strict deadlines for workers to know when they would have planned vacation time. And then additionally, we would want to have work hour limits for salaried employees so that they aren't working an insane amount on top of what the other people are working on just because they're salaried. We'd also like to set dates for monthly meetings for each team. And that would include team members themselves, what they think camaraderie means and what would make them feel like they belonged, and have opportunities for team bonding and tailor that to future meetings to accommodate those goals on top of accomplishing what the team meetings need to accomplish and get the information across. Additionally, we would like to encourage work-life balance, which would include encouraging use of PTO and hopefully being able to offer counseling sessions for grief, anxiety, and depression that healthcare workers experience and just the additional stress. And then also having childcare services available for people who have children, because when it's hard for them to get to work, people don't have childcare, and also with childcare being expensive, that would be an important step to take to make them feel better about coming to work every day, knowing that their kids are taken care of during the day. We would also like to prioritize internal promotions and offer applications for positions that are open to workers that are already within the system before opening it to outside applicants. And then also just make sure that workers that are doing an exceptionally good job are getting recognized. In other hospitals, there's something called the Daisy Award for nurses, which patients and their coworkers can nominate them for. And that's something that should be global and for all workers in the hospital, specifically like the janitor that talked to his patients, spent extra time with his patients, like that's something that should be recognized. And then giving yearly recognition to people who have been working in the hospital for a year, like they have rewards for their work anniversaries. And then finally, for short term, to promote workplace productivity, we would want to kind of what Chris had said earlier, having the modules about bias and compliance, and then consider allowing coworkers to give testimonials of own experiences and what they care about, and kind of get everyone on the same page about what they should be caring about, and ultimately the and then for more long-term goals, some of the short-term goals are intertwined with the long-term goals because a lot of our short-term resolutions require money. So ultimately, long-term, we would need to reorganize the hospital's budget to prioritize team members. If team members are prioritized and then they will be able to give the best care when they're working at their best. So something that we would reprioritize is increased pay for workers. The counseling session and childcare services are some additional funding that we would require. And that might also mean that more higher paid professions might have to take pay cuts, such as the CEOs, which would just be something that would be a long-term discussion. Additionally, we would need to hire more employees to ensure everyone gets the fair amount of paid time off and to make up for any sick absences that would be necessary. And obviously that's a system-wide problem. And I think that with the changes that we've discussed, if those are able to be made, that the healthcare in general will be a more appealing profession to enter into. So that's a very long-term goal. And then finally, we would want to expand the employee healthcare coverage, and that would require system and federal policy changes as well. And then just for the interprofessional involvement, it would require cooperation from all fields. And just kind of, I think it would be important for all of the different fields to learn about what the different professions do. It would be important for doctors to know what PT and OT consists of, what speech consists of, and when they're making those consultations, what exactly they're asking for, so that they know what the patient is getting and how the patient will benefit. So that will require some interprofessional involvement, and as well as just kind of everyone understanding where they're coming from, so that we can foster an environment of communication and non-judgment.
So for our metrics of success, we want to be able to see how our plan, how successful our plan is. And these are a few things that give us an idea of how successful it would be. So the first thing would be improved employee wellness. So happier employees just lead to better work productivity and overall better teamwork. And then the employee turnover rate and less people leaving the profession would just show us that it indeed is a good place to work and people are getting a good work-life balance there. Overall work satisfaction, better healthcare outcomes, increase in productivity, engagement from interprofessional team members, and then also employee engagement in meetings and projects. And this just kind of shows us that employees are satisfied with their work and they're more likely to participate in meetings and give their feedback this way if they feel like they're actually being heard and appreciated.
Our plan is sustainable because of the low financial expense. The United States Bureau of Labor Statistics reported the healthcare sector lost nearly 500,000 workers in the first 20 months of the COVID pandemic. So from an administration standpoint, replacement costs can go as high as 150% of the employee's base salary just to replace them. So it'd make more sense to spend that 50% on like preventative stress measures to make sure that employees don't quit. And we're going to scale our plan by looking at first equitable outcomes. We can run a cost benefit analysis after the intervention compared to baseline, and that can quantify results in patient outcomes. And secondly, we're going to look at the perceived stress scale, PSS-10, of the healthcare employees. We can collect a score at baseline, then after 3 months, and then annually to quantify if employee stress reduction is statistically significant. And next is lesson learned. The first lesson that we learned is team working allows for better outcomes, basically by less burnout. Secondly, we learned that it's easier to produce the best outcomes when responsibility are shared and there is support between team members. Thirdly, we learned that measuring success as an organization is of the utmost importance when it comes to employee satisfaction. And lastly, we learned that team members are able to apply their own expertise into a project, preventing